been practicing here for a long time, and there's been a lot of changes in access to medical care here and to hospital care.
Inadequate access to health care in rural areas of eastern Kentucky has resulted in incredibly poor patient outcomes, such as higher rates of disease progression and failure of detection. As of 2013, the Kentucky State Health Assessment reported that more than 1 out of every 3 adults in Kentucky has high blood pressure. Left untreated, hypertension leads to comorbidities such as stroke, heart disease, congestive heart failure, and kidney disease. Unfortunately, these comorbidities are not uncommon to Kentucky, as heart disease remains a leading cause of death according to the CDC. Some of the most prominent factors in eastern Kentucky that contribute to patients' healthcare needs not being satisfactorily met include health professional shortage areas, lack of insurance, and low educational attainment. Under the current healthcare system, the Kentucky Department of Insurance reports that approximately 694,000 individuals in Kentucky are still uninsured. The large number of uninsured individuals, combined with the scarcity of primary health physicians in rural Kentucky, contribute to the population's inadequate access to health care.
I'm Steve Burkhardt, and I'm a physician doing essentially general practice in an area that has, I guess our area would be not more than 10,000 people in the whole area. It's 2 counties, Crittenden and Livingston, and the distances involved in it are probably 40 miles one direction and about 10 across.
What do you think is the biggest issue regarding access to healthcare in rural areas?
Well, the biggest issue has been in the past money, and who supplies it and who pays, and that has changed somewhat. Of course, access in this area has more to do with distances, two things, because the nearest specialties other than surgery, we have surgery in this area, but other than that, and we have cardiologists that come to the local hospitals, and we do have oncologists that come to local hospitals. But any other specialty, you're going to have to travel 30, 40 miles to get to. And that's not a big barrier. It's not as bad as it was 30 or 40 years ago, but it is still a barrier. And people, that is going to be a significant problem, because people who have hypertension from even some of the other things, heredity or a lifestyle, and once they get hypertension, then it's not too far, especially if it's untreated, that you will end up with enlarged heart, cardiomegaly, and you'll end up then with heart failure, and then your coronary artery disease will be more likely too in those people. Of course, renal failure is a very significant part of that if it's untreated, and maybe so anyway. Of course, diabetes leads to the renal failure too. So screening and knowledge about how to not be hypertensive, which would be, of course, the diet, we're looking at salt to some extent, and not be a diabetic would be very helpful, because these are the ones that really do the most to our population, is diabetes and hypertension and coronary artery disease, and they're all tied in together. And that's a major part of what I see in the office, are those chronic diseases or something that's come from them. And
A study by ResearchGate found that there are two general patterns in the geographic differences in the staging of cancer at diagnosis. First, malignancies diagnosed among rural residents were more likely to have been unstaged than were those among urban residents. Second, among those with a known malignancy, rural patients had more advanced disease than urban patients. As we have already established, there is a great need for increased and improved health screening access in rural U.S. so that various health concerns may be taught and treated earlier on. In 2003, another study sought to find evidence to support this claim. Those conducting the study set up pharmacist-delivered health screening services for cardiovascular problems in a rural community. As people utilized the service, 80% received information regarding how to change their lifestyle in order to be healthier. For example, lowering hypertension, exercising, and smoking cessation. An incredible 30% were referred to general health care providers to address their more serious health problems that they were unaware of. With more health care screening access, there will be improved health outcomes. Patients will be made aware of their conditions at an earlier stage and be able to begin treatment more quickly. The most impactful solution for this problem is for health screenings to be made more accessible, particularly to those in rural communities who have already had decreased amount of access.
Comparing urban healthcare access to rural access shows a huge difference. As we know, people in rural communities have fewer specialized doctors and/or departments. They also have fewer hospitals. Due to the insufficient access to healthcare, the mortality rate in rural communities is higher than in urban areas where access to healthcare is sufficient. As you look at this chart, the numbers 1 through 4 are rankings based on the degree of a person's health. The first quartile is the healthiest, and the fourth is chronic disease. One can see that as a person's health progresses in a rural area, the risk of problems such as mortality increase well above that of someone living in an urban area. Therefore, someone living in a rural area undiagnosed with hypertension has a higher chance of developing further problems from it than someone in an urban county. By visualizing the future, we can see what type of impact we can make on early diagnoses of diseases. By doing traveling health fairs, we can bring screening equipment and knowledge to distant, rural, and sometimes knowledge-deficient counties. By doing this, we can educate people on different progressive diseases, such as hypertension, diabetes, and cancer. We can provide screenings of these to patients to try and catch the disease early.
I think probably one of the things, I don't know exactly how it needs to be done, but if somebody had some method or to be able to intervene with young people, like your high school you're talking about preventative things, about smoking, about all of these things. And
we believe that by going into high schools with mobile health vans and conducting health fairs, we could provide the early education needed to avoid chronic conditions such as hypertension. One study from Harvard followed around 237 people with hypertension and tracked their progress over several visits. These visits included education, medication, and diet training if needed. Their progress over these visits were calculated to be a risk reduction in 32.4% in myocardial infarctions and a 44% in stroke-associated risk. With these findings, we could see that there is a significant improvement in outcomes among individuals who are seen by mobile health clinics. Another study in Massachusetts showed that the mobile health clinics saved the healthcare system approximately $1.6 million a year. In summary, by using mobile health clinics, you are able to go to the students and not wait till they come to you. By giving the youth early and improved access to healthcare, they will get the screenings necessary for early detection, while gaining the knowledge and training needed to prevent chronic conditions such as hypertension, and ultimately have a healthier lifestyle.